Hi, I'm Gareth. I'm a psychiatrist and medical director in the UK, and I'm making videos about open dialogue, the transparent and inclusive approach to mental health care. Now, this time I thought it might be interesting for you to hear a bit more about the history of open dialogue. And whilst this isn't going to be a perfect telling of that story, it will be a summary of what I've managed to collect over the years from talking to various team members and a number of different events and the different books that I've read, which will summarise what I've learnt about its history. Let's start with a journey. We're going to go to the east of Europe and we're going to travel up the Gulf of Bothnia to the apex of the Baltic Sea where Finland meets Sweden. Here the border is defined by the river Tornio, and we find the town of Tornio. And Tornio is a border town and so has to navigate a difference in language, with Finnish being a Uralic language by background. It's significantly different from Swedish, which has Indo-European roots. And so we have a people there who have had to spend many generations communicating across a gap in language. As a border town, there was a history of smuggling and long-held caution around authority figures. So that can translate through to whether it's about a customs official or a doctor or a nurse. Tornio sits in the Western Lapland region, far away from the political centre of Helsinki, which has meant that for a long time it's been able to have little interference from the central government. But it also means that it's covering a large geographical region, with Western Lapland going all the way up into the Arctic Circle, low population density, and so if someone needs help from services, there are some very long distances to travel. The main hospital for the people in Tornio and the surrounding area experiencing any mental health problems was Keränen Hospital in Tornio. Now, I've been there. I travelled up there a number of years ago to meet the team and to have a tour of the original hospital and learn more about what they did to develop open dialogue. The building itself is quite utilitarian and wouldn't be unfamiliar to people who've had any experience of mental health institutions around the world in lots of different contexts. And when you talk to the team, what they'll tell you is that in the early 1980s, that Keränen Hospital was full. It had large numbers of patients that were staying for a long period of time. They were struggling to get people admitted into the hospital in a timely fashion, and they were using really high doses of psychotropic medications. And it got to the point where they really just felt like this system isn't working. So the medical director of the Keränen Hospital at the time put out a message to all the staff and said, let's all meet for coffee. Can you all please bring your best ideas and let's have a conversation about how we could try to do things differently. So that meeting took place at Keränen on the 24th of August 1984. There were two key ideas that were put forward during the meeting. The first was put forward by the medical director, Keränen. He was very interested in the work of Professor Aaltonen, which was on needs adaptive therapy. And the key idea out of that he wanted them to pursue was this idea of having all conversations about treatment in front of the person. So they agreed as a group that was a principle they should adopt. The second idea that was put forward in that meeting was put forward by Seikkula. Now, Jaakko is a psychologist who is also a trained systemic family therapist, and he put forward that they should be including the family every time within the care. And so they all agreed that this should be the other principle that they pursued in the way that they were going to deliver the care. I've attended a number of talks by Jaakko over the years and had conversations with him over lunch, asking him about how has open dialogue developed and founded, and they quite often flippantly say, one day, that day. But it does a little bit of disservice to the many, many years of deep reflective research that then went into making their ambition a reality. They would go on to draw from a number of different sources to grow and develop the approach that was eventually going to become open dialogue. One of the influences upon them was the Russian philosopher and literary critic Mikhail Bakhtin. And Bakhtin wrote extensively on the subject of dialogism. He was a social constructionist who believed that truth and meaning emerge between people in the process of dialogue rather than existing in the mind of a single person. The Tornio team collaborated with the Norwegian psychiatrist and family therapist Tom Anderson. He'd been innovating in the approach to family therapy. Now, at the time, most family therapists were trained in an approach to family therapy called the Milan School. This approach you might be familiar with is where a therapist would sit with the family exploring what was going on, whilst the other therapists would sit behind a one-way mirror and they would observe what was going on and reflect amongst themselves around what they hypothesize about the family and the system. Tom's great innovation to this process was to remove the mirror and to bring the whole team in front of the family and to have all those reflections in front of them. And this fit very nicely with those goals and objectives that the Tornio team had of include the family and have all the conversations in front of them. The team also took inspiration from a family therapist working out of Houston, Texas, called Harleen Anderson. Now, Harleen and her colleague Harry Gulishian were very interested in how you worked alongside the person and their family to make them co-researchers and have a collaborative process where you would work together to figure out what was working well about a process and what wasn't. And it was in that spirit that the team in Tornio very much took on these cycles of constantly checking in with families about what's working well about this for you, what could we do differently. Out of this emerged a much more positive psychotherapeutic attitude that tried to reduce the amount it was pathologizing the situations in someone's life and trying to drop any kinds of interventional work with a family and instead just focus on being alongside and with. The Tornio team always had a very strong interest in research, and they would go on to publish a series of papers in the early 2000s that then started to get their attention from outside of their homeland. One of these papers was published in 2003 by Jaakko Seikkula and Brigitte Alakare and colleagues in the Journal of Ethical and Human Sciences and Services. And it followed a cohort of people who'd received open dialogue, comparing it to a group who just had treatment as usual. And it particularly focused on looking at people who'd had first episode psychosis. And what the team found when they looked at the comparing the two groups was some remarkably different outcomes for the open dialogue group. At the 2-year follow-up point, the open dialogue group had experienced relapse in 24% of the participants. The treatment as usual group, that was 71%. When you looked across at the employment and study rate for the two different groups, in open dialogue, 83% of them were back in work or studying, compared to in the treatment as usual group, that was only 30%. And then when you go on to look at the psychotropic medication usage within those two groups, the open dialogue group, 17% of them were using psychotropic medication at 2 years compared to 70% in the treatment as usual group. So some really strikingly different outcomes for the open dialogue people. Now, it's got to be owned straight up front that that was small numbers within that study, and it was in a specific context, which was Western Lapland, up in the north of Finland. But the team went on to publish further papers. In 2006, there was a follow-up paper published in Psychology Research, and this showed that the outcomes were being sustained and getting even better over time. And this was in a growing size of cohort being followed up. But partly because the numbers involved in this research were so small, and because the outcomes were so outlandishly different compared to what we were used to seeing in research across the rest of the Western world, often this research was discounted and not included in any meta-analyses or wider consideration. So there was a need to do some more robust research, and out of that need came a large research program that was developed in the UK. It's called a DESI, and it's being run through UCL and has had about a 10-year journey at this point to get from conceptualization through to publication very soon. And I would love to tell you some more about that in a future video. But for now, I'm really pleased that you have stuck with me and learned a bit about the history of open dialogue. If you've enjoyed the video, please give me a like, subscribe to the channel, and I hope to see you next time. Thank you.